Hello, I am Dr. Amit Sharma. I am a spine surgeon working at Pinnacle Ortho Center in Thane. Spondylosis is a condition which affects everyone's spine. It's not a disease, it's an aging process. Spondylosis means the degeneration of the disc in between the vertebral bodies. Most of the time, spondylosis is used synonymously with the cervical spine. However, spondylosis affects the lumbar spine or the lower back as well. With age, the water content of the disc goes down, and the disc between the two vertebrae will get degenerated. This degenerated disc, when it will move, it will cause pain. So the function of a normal disc between the vertebrae is to provide motion, but at the same time to keep this motion pain-free. But when the disc gets degenerated or they develop spondylosis, this movement itself will cause pain. In certain cases, the part of the disc might come out also, or this spondylosis can be associated with spinal stenosis, in which the disc plus overgrown ligamentum flavum or the facet joint, which are the joints in the back of the vertebral bodies, they overgrow, and all these components together will compress the spinal cord, leading to spinal stenosis. So a spinal stenosis can also be associated with the spondylosis. The symptoms of the patients are primarily localized to the area of spondylosis. So if you are suffering from cervical spondylosis, then your neck will hurt. Similarly, if your lower back is affected, you have lumbar spondylosis, then your lower back will cause pain. If you have associated spinal stenosis or a disc prolapse, or in the layman's term it is called slip disc, if you have spinal stenosis or slip disc also associated with spondylosis, then you might have pain, tingling or numbness going down your arms or legs. The treatment for spondylosis is based on the patient's severity. Most of the patients, especially those where the nerves are not affected, where the spinal stenosis is not associated, they respond very well to the conservative or non-operative treatment, in which a short course of pain medicine and muscle relaxant is given. Along with that, certain medications to take care of the pain which stabilize your nerve are given. Patients are also asked to do physiotherapy. Physiotherapy exercises will actually strengthen your muscles. Some modalities are also used at the same time by physiotherapists, in which ultrasound or interference therapy will be used to reduce your pain and reduce the inflammation around the spinal muscles and the spinal cord. The main function of physiotherapy is to strengthen your muscles so that these strong muscles will be able to support your spine in a better way, so that your pain goes down. Also, the physiotherapy will eliminate the muscle spasm, which itself can become a source of long-term pain secondary to spondylosis. In certain patients where the pain is not responding to the conservative line of treatment, or where there is significant associated spinal stenosis leading to pain, tingling, numbness or weakness in the upper or lower limbs, a surgical intervention might be required. Majority of the patient with spondylosis will require some kind of instrumentation surgery. If spinal stenosis is associated, then a decompression procedure also will be added to it. In cervical spine, majority of the time an anterior approach is taken to replace the disc. However, for a multi-level pathology, a posterior approach with the multi-level instrumentation might be required if multiple discs are affected. Similarly, in the lumbar spine, most of the time L4-5 and L5-S1 levels are affected, so they require a posterior decompression and instrumentation surgery. Most of these surgeries nowadays can be done with a minimally invasive way where the recovery is quick. Majority of the patients are able to sit and walk on the very next day of the surgery, and within 2-3 days after the surgery they are discharged from the hospital. After certain minimally invasive surgery, patients can walk on the very same day of the surgery and can be discharged next day only. If you feel that you are suffering from a spondylosis and it is not responding to conservative or non-operative line of treatment, and if you want further treatment or opinion, please feel free to contact me at Pinnacle Ortho Center, where I sit on Monday, Wednesday and Friday in the morning. The contact details are provided on the screen. Thank you very much.